How we do? Did we go too long?
You went too long. Yeah.
I got to how many questions? How many of the questions did I write
It
down?
was good, but you just went too long, and I'm like, look over here. So I can tell you to wrap it up.
We got too good. I couldn't
It
stop.
was very good.
That's why I didn't look over there. That's why I kept looking over there. 'Cause
Hi, my name is Dr. Glen Warren, and this is the Chat and Chew podcast.
Welcome to Chat and Chew. Real talk, real healing.
From Raleigh roots to hearts renewed, we're building men, we're breaking through, healing fathers, saving families too. That's what we do at Chat and Chew. Second chances, brand new views, strong and resilient, coming through, bringing fathers all the way back home with care, with heart, with love, our own.
Fathers forever. Yeah.
Please make sure you follow us on Facebook, like and subscribe to our YouTube channel, and of course, hit the bell to activate notifications to let you know when we're on. Be sure to leave us a comment to let us know how we're doing. We'd love to hear from you.
Greetings once again. Welcome to Fathers Forever Chat and Chew. We are honored to be here, and we hope you tune in and to our broadcast today. Please, if you don't mind, call somebody or tell somebody we're on. Invite to our Facebook friends. Also on YouTube, hit the little bell. And please add a comment. Let us know that you're watching. Again, welcome to our Chat and Chew. I have special guests in the audience today. We're going to be talking about from crisis to care, how community partnership save lives in recovery. And in our studios, we have Miss Consuela Chapman from the Carter Clinic, and we're going to let her introduce herself in a minute. And we also have one of our staff, Mr. Dwayne Williams, one of our house managers. He managed our Hope Opioid House. So welcome to Fathers Forever Chat and Chew, and we're going to get right into this episode. First, Mrs. Consuela, I hope I'm pronouncing your name right. Tell us a little about you. And then we get into the Carter Clinic. Tell us a little bit about you first.
All right. Well, I am a licensed clinical social worker, licensed clinical addiction specialist, health coach, certified clinical supervisor. I've been in the field for over 15 years.
Wow.
Helping people improve their well-being, I like to say.
Okay.
I worked in a variety of different practice areas, including home health hospice, the psychiatric residential treatment facility, and some things in between, including the military as a military family life counselor. I've done a little bit of everything. And
Wow. You got kids? You live in Raleigh? Are you from Raleigh?
I do. I have two adult children. I was just thinking this morning, I'm like, man, my daughter's going to be 26.
Oh, wow.
And I got a 32-year-old, and I got some grandkids.
Oh, cool. Great. Good.
Just had my last grandbaby was born December 26th.
Oh, this year?
Yeah.
Oh, wow. How many grandkids you got now?
I have 3.
Wow. Okay, cool. Well, congratulations.
Thank you.
So, and Mr. Dwayne, tell us a little bit about yourself.
Yes, my name is Dwayne Williams. I've been working with Fathers Forever for now since 2017. I have a degree in psychology and my master's is in applied behavioral science. I worked in the field for over 30-some years with geriatrics, juveniles, mentally impaired. You name it, I've done it. I have a passion for the community. And drug addiction had affected my family, so I went into that area specifically because I seen how it can devastate not only the person but the family.
Mm-hmm. Right. Well, today we have a partnership with the Carter Clinic where we feed some referrals. So we're going to be talking about mental health, addiction, recovery, reentry, and fatherhood, kind of combined together. And we're going to talk about how wraparound services is connected to homes and stability. And we want to really talk about the Carter Clinic and what you guys provide in the community and the neighborhood. And so the first question is, I'll start with you. When someone is battling addiction, mental health challenges, what does real recovery look like? And how does housing really matter in that recovery?
That's a good question. So, real recovery looks like not engaging in the same behaviors. Or being around the same people, places, and things that contributed and exacerbated the addiction. And there's a saying where you have to really change your people, places, and things. That's part of the AA model. If you want lasting change, there's a model called Housing First that basically says that that's really the foundation. Where you're laying your head, your place of peace,
Right.
per se. That's really going to be one of the determining factors in long-term recovery and stability.
Right. So housing is I would be, if I didn't know what I was going to lay my head at that night, that in itself is enough anxiety that causes people to do all kind of,
Oh, most definitely. Not only your head, but think if you're a parent,
Right.
and you don't know where your children are gonna lay their head or get their next meal. And so what happens is people have a tendency to do what? They self-medicate.
Right.
They
Right.
think that spending that $10 on this or whatever it is
Right.
gonna make them emotionally numb and not feel the stress.
Right.
But all it does is compound
Right.
the issue, and
Right.
nobody uses with the intention of becoming addicted.
Right. Same question, Dwayne.
I think housing is the very key component because running the opioid program, I've seen how the guys, knowing that they have a safe and comfortable place to stay, how it changes their whole dynamic of their outlook. They just look different. Their shoulders up broader.
Right.
They have a smile on their face. They're clean. They can take a bath. Some of us take for granted going to bathe or brushing our teeth or just having a hot meal and being warm. One of the guys told me, he said, he started crying and it almost made me cry because he said, I haven't had a warm bed in over 3 months.
Wow.
And I'm like, what do you mean? He said, I was standing in the streets. My family didn't want me. I couldn't get in the shelter. I couldn't get in this program. I couldn't get in this program. And I thank God for this program because he was at his wit's end and he thought he was going to take his life.
Wow. So, guys who struggling with addiction, I say guys, we're talking about people in general. But our specific is men. We have 46 beds that we provide housing for guys for 90 days. We have the Department of DHC, but we also have an opiate house, and that's where we get the referrals from the cardiac clinic and others. And that part to us is important because a lot of times our guys need the therapy, they need that support, they need the wraparound services that you guys provide, and the housing part that we provide that makes it all the world. Because now, like Dwayne said, a lot of the guys, they done burnt bridges at their home because of their addiction.
Exactly.
A lot of times now they separated from their kids. And one of the main things that we found with fathers is the depression, the feel of guilt of not being able to take care of their kids. And what we kind of focus on is help them come all the way. And I just read a book called Bring Him All the Way Home. Because a lot of times we tell them, see your PO appointment, see your therapist, get a job, get a place to stay at, but we don't help them connect with their kids. And that's one of the main things that they...
Yeah, the children are an anchor for men. And, when you talk to, I'm sure many of your men, they'll say, having kids changed my life. Or
Right.
my children saved my life.
Right. Yeah. And then, now you're dealing with the guilt. I've been separated. I've done some bad things. I've got some choices. And now they'll struggle. And a lot of times they don't come to us and say, hey, Mr. Glenn, I need some help being a good dad. They don't tell me that because sometimes they think I am a good dad, even though you miss it. And so as a community, if we don't push that, if we don't be the one who initiate that, and that's why I'm so glad for the partnership that those guys can come and get the therapy that they need from the Carter Clinic. You guys do medication. Tell us some of the other things you guys do.
Oh yeah, so we do medication management. Of course, with opiate use, medication assisted therapy. We do individuals. We do group. We also offer peer support. We offer an ACT team, and you also do skill building. One of the things, particularly this year, is offering skill building like financial literacy and things of that nature. Friday we actually volunteered with Habitat for Humanity, because one of the things, going back to the housing, is once people come out of the transitional housing, they still need long-term housing.
Right.
So we want to be able to help connect individuals as well to where they can apply for the Nehemiah loans and programs and Habitat, so they can get a home, not just a house.
Right. So when y'all do deal with the, what do y'all get y'all referrals from?
So we get our referrals primarily word of mouth, through the MCOs, through partnerships like Fathers Forever, Rise Collective, just to name a few. It all kind of depends, because we got 12 locations.
Yeah, wow, you guys are all over. Y'all in Fayetteville, you said, Lumberton, Rocky Mount, Wilson,
Shelby, and I'm stumped.
Yeah,
Wilmington.
yeah, you said it,
Everywhere.
but it's good. How long has the Carter Clinic been around?
We've been around for over 20 years. The Carter Clinic started with Dr. James Carter. He was one of the first Duke trained psychiatrists. And then Dr. Ojinga Harrison, basically, from my understanding, he was a mentor for Dr. Harrison.
Oh, wow.
And they worked together, and and when his untimely passing, Dr. Harrison bought the clinic and.
Yeah, I think my days in Wake County. I think I remember Dr. Carter from. I don't know. It's another guy named Dr. James Smith though. But so, when it comes down to justice served men, do y'all guys deal with a lot of guys that's just coming out of incarceration?
The numbers I couldn't give you specifically, but we have launched an initiative where we want the formerly incarcerated and justice involved to look at the Carter Clinic as their first step in continuing their mental health and addiction treatment.
Right.
We have a radio show that we sponsor on 92.1 called Sunday Visitation.
Okay.
My co-host is Kerwin Pittman, who is a nationally known reentry advocate.
Oh, wow.
And
when did that come on?
It comes on Sundays at 10 p.m.
Oh, wow, okay.
Does Curran Pittman sound familiar?
Yeah, Kerwin was actually at the ILI conference where he got some type of innovator award, because he also has a mobile unit.
Yeah, right, okay.
Where that's specifically for
Right.
People who have been formerly incarcerated. He's led like some expungement clinics.
Yeah, I know him.
Yeah.
Okay.
He does some really good work.
Yeah.
And most recently he made national news for buying a prison. So
yes, he's in Goldsboro.
Yeah, the prison. Yeah. So
wow.
Having him become a part of the show, when I needed a co-host, I automatically knew who I wanted it to be, it's a great show.
So let's talk about opiates.
We want you on the show too.
Yes, I would love to come. Yes, let's talk about opiates. Opiates is that's a monster in itself.
It is, and you know what? When I first started back in 2010, because I graduated from the illustrious Fayetteville State University.
Okay. Well, we won't hold that against you. I went to St. Louis, Falcon.
Okay. So my first position as a counselor was with the Carter Clinic in their Fayetteville office, and that was when I first really got to see the impact of this opiate crisis and how young it was hitting people. I never forget. I had a young man who he had started in high school. You know, parents had sent him over to a residential treatment facility in California more than one time, and you know, it was kind of devastating to see, you know, someone that had really from the outside all the things to be successful. Your parents were successful, you know, money wasn't an option, you know, but the opiates had took a hold of them.
What are some of the gaps you see in providing for people with opiates?
Well, some of the gaps I see really comes down to access. There's still stigma. There's still shame. You know, there's a group when we think about perinatal health, women, pregnant women, you know, that are using. You know, and you know what I learned last year sometime. Volunteers for America, they got a contract to do a residential facility for pregnant women because of the impact of opiate use.
Right.
And particularly, you know, when we think about perinatal and maternal health, you know, Black women in particular, you know, have a higher rate of death.
Wow. Dwayne, same question. What do you see in some of the gaps? I mean, we got a whole house full of guys who's has got a history of opiates.
Some of the biggest gaps that I see is, as she said, is access to the services in the community. A lot of times they don't know that there's services out there. And then when they do find the services, it seems like you have to claw your way to get into them. Instead of like being able to just go in and access the services, you know, of course there's paperwork and questions, but they send the guys through this litany of questions. They're already frustrated. They already don't have the patience. So they don't feel like they're welcome.
Right.
They feel like, oh, they don't want me here anyway, so I'll go back.
Right.
And so that shame that, as you spoke of, they already, when you're trying to talk them into going to get help, you know, you have to kind of coach them. But then when they get there, they feel like they don't want to help me anyway.
Or they're treated, you know, 'cause remember there's still this stigma around addiction. And sometimes, you know, unknowingly or maybe even knowingly, people speak down to someone who has an addiction. I worked for a clinic in Durham, you know, and one of the things I'll never forget is, you know, these people were professionals. These people still had jobs. You know, a lot of these folks had injuries. You know, they were former athletes or whatever. They just want just some, you know, willy-nilly.
Right.
You know what I'm saying?
Right.
And then you got these providers, some of them who, you know, talk to them in this, you know, this condescending way. And they're like, you know, it's makes someone not want to deal with the system. And then you have some providers who they're cash only, you know, or they're self-pay only.
Wow.
People can't afford $175
for a visit,
you know, a week, you know, because they want you to come every week. The first 4 to 8 weeks,
Yeah.
and then you know, I mean, it's a struggle.
Transportation, because most of them don't have cars. The bus system is not a very reliable system, and a lot of times, wherever the participant is at, the clinic may be way on the other side of town, and then if the bus gets some partial there, they have to walk the rest of the way to get there. Mm-hmm. So that's, you know, it's just all these barriers that they have to overcome sometimes, and it's ridiculous. And I'm glad you said that about the treatment of our participants. One of the things I've learned by running the opioid house, the compassion part. The compassion part goes a long way, because when somebody feel like you're talking down to them, when they feel like you don't care, they don't want it. It could be the best room in the world, covers and everything. I don't want to stay here. You made me feel like an animal.
Right.
And that was one of the things, learning on my part and with my staff, to like, no, I want you to treat them like that's your brother, your sister, your mom, or your dad.
At the end of the day, that's a man, or that's a woman.
Right.
And they're an adult, and you need to respect them and talk
Right.
to them in the same manner you
Right.
would talk to anybody else.
Right. Right. What makes you? What are some of the criterias that help you with referring men to our program? What are some of the things that you look for?
Honestly, Glenn, I'm not part of the referral process. I guess when I gave my introduction, I should have told
No,
you.
that's
Yeah.
okay.
But my role is director of business development. Our referrals actually come from her name is Shalita.
Yeah, I think.
She works up at part of our administrative
Right.
our team. And so, it all kind of depends on, ASAM, right? Placement criteria.
Right.
Is going to determine if this level of care is
Right.
is what it's
Right.
about.
Right. So Dwayne, when you're looking for referrals,
So when we're looking for referrals, the biggest thing is, first of all, I need you to have an opioid background.
Right.
Unfortunately, I can't take you if you have just cocaine. I can't take you if you just have marijuana. That's the first thing. Most opiate users are dual diagnosed, and sometimes that goes underserved. One, we want to either treat the addiction or we're going to treat the mental health, but you got to treat both of them. So I look for guys that are actually serious about their recovery. I look for guys that have said, yeah, honesty, I'm still struggling. I used 2 weeks ago, but I need help. The willingness to ask for help, that's the first step. And we don't really turn anybody away. If I got the space, I'm going to let you into the program.
Right.
I'm going to give you the opportunity because, unfortunately, with addiction, relapse.
Oh,
It's
that's
a part-
part of the that's
it's
part
part
of
of
the
recovery.
That's part of the journey.
And so, dealing with one of our community partners says like, well, we don't want to share information with you guys because, they relapse, you're going to ask them to leave. I said, no, this is not how this model operates. We want to know where they are relapsing at because then we need to know how to attack what we need. We need more therapy sessions. Maybe we need more job training. Maybe we need more mentoring. Anything but do not neglect sharing that information because we need to know where they're struggling at. And so we don't turn anybody away. I'll say that. We don't turn anybody away. The only way that I may say that you cannot come if you are violent and are a threat to yourself or others, then I have to offer other services in the community for you. Then I'll say, once you get that taken care of, come on back.
right.
Come on back.
So, and as we kind of wrap this up, how do addiction affect family in general?
Addiction is a family disease, and honestly, it's it's like a cancer.
Yeah.
Just like genetics or biologically, someone may be predisposed for cancer. When you go to the doctor and they
Right.
say, their family history of cancer.
Right.
Addiction is the same thing. An individual who had a mother or a father or a grandparent who was an alcoholic or even a degenerate gambler, they have a predisposed nature of becoming addicted to something.
Right. And it's devastating to families.
Oh, most definitely.
A lot of times, as they say, you're a product of the environment that you're in. And when you see this constantly, you think, oh, this is right. This is the right thing to do. We have one guy, and I'm glad you said that. It doesn't matter from the poorest of the poor to the richest of the rich. As you say, this young man had everything. Money, everything. And unfortunately, he lost his life recently. It was an unfortunate accident, but he was so young and so talented. And he didn't see it. And it kind of really still bothers me that we tried And sometimes I'm like, well, where did I fail?
As a clinician, I definitely understand because in my past work I've lost a client as well, and it was, because we know the faces.
Right,
And
yeah.
when somebody doesn't show up one week, it's like, okay, well,
Right.
they don't show up the next week. Okay,
Right.
okay, well, wait a minute. Hey, what happened?
Yeah.
And then you get the news, and it's as a compassionate person, as a helper,
Right.
it's natural for us
Right.
to wonder, did I miss something?
Right.
Is there something else I could have done? Because every life is valuable.
Right.
And it's
Yeah, we've had a
same thing.
couple of ODs. We've had a couple. When my days at Wake County, I lost a client, and he was really, really depressed, and we had got him out of depression to some degree. I mean, he was so depressed he couldn't put a plan together for suicide. That's how depressed he was. But as he came up to being able to formulate a plan, he got stuck right there, and he did it. And I was questioning myself, what couldn't we see that coming? Because, he looked like he was doing well. And so that is the human part of us. So what do you do when you go home? How do you shake this? How do you transition from, listen to people's stories, sometimes tragic, addiction and losing family members? What do you do to get back?
Honestly, I do everything I can to protect my peace. But before we start, I told y'all I don't even watch the news.
Right.
Because you're being inundated with
Right.
negativity.
Right.
And as a licensed listener per se, trauma therapist, it's important for you to be able to have a boundary to where you don't, whether it's personal, family members, if somebody calls and it's like I don't want to hear that today.
Right. Exactly.
And not to take it personally. This
Right.
is something. I got to do this for me.
Right, exactly.
But I meditate. I'm also a 200-hour meditation teacher, and I work out. So you travel. I got to change my people, places, and things just like
Right,
everybody else.
exactly. Right.
But those are some of the things that I do to recharge.
Right.
And I'm a life learner. So.
Right. Cool.
What about you? What about y'all?
I love movies, and I can binge on movies. My wife and I, sometimes we sit all day long, we just watch movies and travel. I love to write, so sometimes I can just be on my computer or on my phone, and I write short stories, and I could just get in, and 2 hours is gone.
Yeah.
And I've created this. It's when I was transitioning from, I went through my first divorce, only divorce. I watched a couple of movies, like The Lion King. That movie, I don't know what about that movie that helped me get from one spot to the other spot, but I watched that movie over and over and over and over again, and it really did something in my psyche that really helped me get over what I was going through. And a couple other movies I've watched 1,000 times. And I don't know about what it's about me to love to watch the same movie over and over and over again.
Oh, I do the same thing. I can watch The Gladiator over and over and over.
Right.
It used to, back in the day, it used to be what was it? The guy, what was it? Arnold Schwarzenegger.
No.
No, it was his older movies. It was kind of like Gladiator, but he I can't think of the movie. But it was like maybe like a 4.
Oh, I know you're talking about. I know you're talking about.
Conan.
Yeah.
I could watch
Conan the
one,
Barbarian.
2,
Yeah.
back to back.
Right.
But it's something about in those type of movies. There's a theme of perseverance.
Yes.
And strength.
Right.
And community.
Right.
Where he brings people together that
Yeah.
I think resonates.
Right.
Now that I think about it.
Right. Well, there's I'm from the country, so I love horses. I haven't ridden in a long time. But a movie called Seabiscuit, which is about a horse. but it was about perseverance. It was about this little horse was a a thoroughbred horse, but because they had beat him so much, and forced him to lose, the guy said he forgot how to run, and the first thing he did was take him out and let him run, and he ran until he almost dropped, because that was in his DNA, but because they had forced him to lose, and because he was so stubborn. But there's a lot of times that people struggle with a lot of things, and addiction sometimes is that medicine that they need, or they think they need.
Yeah, there's definitely a correlation between trauma and addiction. And it doesn't have to be necessarily a trauma where someone was, physically assaulted or raped or anything. It could be a car accident.
Right.
It could be mental and emotional trauma. But I like to tell people you have to give yourself permission to feel. You got to feel to heal.
Right.
And drugs, alcohol, it numbs you. I like to use alcohol. I use a lot of metaphors. That's the extinguisher. You're feeling something. You're feeling that burn. Usually like a heartbreak or whatever.
Right.
You don't like the way. I need a drink. You're feeling that stress. I need a drink.
Right.
No, feelings are temporary, just like the positive ones or the negative ones.
Right. You said something earlier, and I think we gotta wrap it up. Some people who are addiction, they're not lifelong drug users. They were successful business people who had a trauma, an accident, got hooked on some opiates, and next thing they know, they're addicted to it, and their life is just kind of unraveled. They lost everything, and they show up at your door.
And the doctors who were giving them, a 90-day supply, knowing, and then another 90-day supply, and what happens when the pain is no longer there? Now it gives you a different euphoric feeling.
Right.
And like I'm very frank when I talk with my folks, because I used to do a group, like I said, in Durham. You could have said no. You didn't have to fill the prescription. You got to also take accountability.
Right.
For how we got here.
Right. So in closing, what would you say to our audience? I think that camera right there.
Silence feeds shame. And your story deserves to be told. And part of telling your story helps connect others and alleviate shame and stigma. And, the Carter Clinic wants to be a place for you to come and feel comfortable sharing your story. We have a wealth of qualified clinicians who create a safe space for individuals just like you. And our providers, our medication management providers, are very welcoming, down to earth, and we just want to help because we believe together we thrive.
Dwayne?
I think she just wrapped it up in a nutshell.
Okay.
I really do, because the reason I work with Fathers Forever is because of the mission statement. Healing fathers, saving families. And since I've been here, I've seen it. I've seen it for myself. It's untraditional, but it works. Right. It really works because we really care about you. We care about you, and we go the extra mile. I may can't help you, but I'm going to direct you to where you can get the help at. And one thing about me, when I'm dealing with my participants, I'm never going to lie to you. I'm never going to lie to you. I'm going to always give you the truth. Whether it hurts or not, I'm going to give you the truth because I need you to face your fears. And I was saying that, I thank Dr. Warren and I thank Miss Consuela for coming and talking to us today. It has been a pleasure.
Yeah, thank you.
I couldn't wait.
Thank you so much for
Thank
being.
you.
We're going to join your podcast soon.
Yes.
To my audience, I really shout out to the Carter Clinic for all the amazing work you guys are doing in the community with 10 or 12 sites. You guys are doing wonderful things. And I think your broadcast comes on at Sunday night.
Yes,
11
Sundays
o'clock?
at 10 p.m.
Yeah, 10 p.m. What station is it?
92.1, the
yeah.
People's.
Okay.
Yeah.
Yes, and so until we meet again, I want to say, please do yourself a favor, get the help that you need, the mental help. If you struggle with any kind of addiction, call the Carter Clinic, call other people. There's help for you, and We want you to be safe and sound. And until we meet again, I'll say Father Forever. It's all about healing fathers and saving families.
Take part in the Dads at a Distance initiative by giving a copy of I Am a Father Forever to a friend or family member, or host a reverse book signing at your business, church, or organization. You can also contribute by joining the Fathers Forever monthly donor membership program. By becoming a monthly donor, you're directly contributing to the success of Fathers Forever programs and the men we serve. Choose the level of support that's right for you and enjoy exclusive perks designed to connect you to our mission and impact. For more information about this or any other method of support, please visit our website at www.afatherforever.com/donate.